All right. Has your knee been replaced? Can you kneel on it?
That's it's a good question,
Yeah,
Bob.
we have an expert to answer your question.
Bob and Brad, the two most famous physical therapists on the internet.
All right. First, we're going to hear from surgeon Dr. Dane Hansen. He's from Summit Orthopedics, and he's going to answer the question.
And that's what he does, knee surgery.
Right. Lots of them. This next question I actually had too. I mean, can you kneel after knee surgery, after replacement?
So you can. So a knee replacement, we haven't proven that kneeling on your knee replacement damages it or causes any major problems to it. I would say the vast majority of people don't really enjoy kneeling. And the reason is, I think, two things. One is just, you have an implant. And when you do a knee replacement, the majority of knee replacements, you put a new surface on the underside of your kneecap.
Kneecap, right.
And so even though your kneecap is still there and the bone structure is still there, that pressure you put on that implant and into the knee is much different than what your normal knee would do. And so that's uncomfortable for a lot of people. And then secondarily, your incision for your knee replacement is typically right over the kneecap.
Oh, sure.
And that can be sensitive just because it's some scar tissue there. And it also causes some numbness in the knee right around that incision. And so it's a much different experience to kneel afterwards, but you can. I have plenty of patients that do. I think probably the best advice is if you do need to kneel or want to kneel for different things, if it's working around the house, if it's gardening, if it's how what you do for work, using pads, whether it's a foam pad on the ground, wearing knee pads, I think it'll be much more comfortable that way.
Are you ever worried about the bone being too thin in the patella and you might break it or not?
Yes, that's not common, but you can see patients when they have really severe kneecap arthritis, they can erode a large portion of that bone away. And yes, we do kind of have a minimum thickness that we need to feel comfortable putting that new surface on, because you have to drill small little holes into the bone to hold, for pegs, they're called, to hold those into place. And a fractured kneecap is, one of the worst things that can happen after knee replacement, because it can really significantly affect function. They're hard to fix. And so, yeah, I've had a handful. It doesn't happen often, but I've had a handful where you kind of have to choose just to leave what's there alone.
Gotcha.
And it doesn't drastically affect the function, but it's just there are some of those times where people have gone so far down the road and have dealt with it for so long that bone structure is really damaged.
Okay, I just did want to interject here. Historically, over the last 25 years of me doing this, I've had some patients that had to get back to a job where they're kneeling.
They had to.
Yep, and I've always said, we need to talk to your surgeon to make sure, and then the surgeon, most of the time,
says yes.
Yes, exactly. What they always say, you got to be careful, and knee pads.
Right.
If you're just going to kneel occasionally, you might want to just have
a pad,
a nice cushion. These are Pete's Choice. We love them for many things, but it's a nice firm cushion, and it very comfortable, and it does really well. If you lean forward like this, that's not going to work.
Right.
You want to
stay back,
keep the pressure on the tibial plateau.
Stay off the kneecap.
Right. And so it works out fairly well like this. So you're going to be careful. If you're on a job, like I had one patient, he was a carpenter, he was on the floor, and he actually and he had to move while on his knees, because you're not going to get up and down 300 times every time you move a section down. So a good knee pad. And you want a good industrial one, a commercial duty one, something that has you put Velcro on, they go on and off easily. It's really your choice. I personally like the ones that have cushion and then they have an outer plastic shell, because that really spreads
off the kneecap, right?
Right. Yeah. When you bend it, it keeps the force spread out, and the vast majority goes onto the tibial
Right.
plateau, and they're very comfortable
They
as
know
well.
what they're doing.
Yeah, and they typically cost more.
Right.
But boy, it's a lot cheaper than a knee.
Yeah, if you're living, gotta go for it.
So very good. Good luck with kneeling on your new knee,
Good
and
luck
be
with your knee.
Yeah, be careful.